Transfer patient from bed to wheelchair. Introduction. This skill involves demonstrating correct body mechanics and safety awareness. The patient will be lying in bed at the beginning of the skill. You will pivot the patient to the side of the bed and, using a gait belt, transfer the patient into a wheelchair using one smooth, continuous movement. The wheelchair has multiple parts. It's good to be familiar with the basic parts of a wheelchair, such as the back, the arms, the seat, the footrests, the foot pedal release lever, the brakes, the wheels, and the handles. There are many different types of wheelchairs, but most function in similar ways. Wheelchairs collapse for storage by pulling up on the seat and are opened by pulling the handles apart. Your evaluator will explain how the wheelchair in your testing facility works. It is vital that all healthcare workers know how to lock and unlock the wheelchair. To apply the lock, push the lever forward. To release the lock, pull the lever backward. Different wheelchairs may have different release levers for the leg rests. Most have a lever that is pushed outward to release the leg rests so they swing to the side to make the wheelchair more accessible during transfers. Foot pedals on a wheelchair are designed to fold up for storage. This also allows for more room when transferring a patient into the wheelchair. Foot pedals should be up and swung out to the side to present a wide opening in front of the wheelchair before transferring a patient into the wheelchair. After performing the opening and gathering your supplies, make sure you explain to the patient what you will be doing to gain their cooperation. Have the patient scoot toward you, close to the edge of the bed, and cross their arms over their chest. The entire bed needs to be in the lowest position to the floor. However, you may elevate the head of the bed to make the pivot easier if you desire. This pivot can be done from a lying position or a sitting position. Place one of your arms under the patient's shoulders and grasp the furthest shoulder with your hand. Put the other arm over the patient's legs and grasp the farthest knee. The patient's legs may be crossed to make the pivot easier if you desire. Stand right next to the bed, feet shoulder width apart, and push your lower legs against the bed for support. You also need to make sure the bed is locked. Bend your knees and count to 3. On 3, push upward with your arm under the shoulders and pull the patient's legs towards you in a smooth pivot motion. Once the patient is in a sitting position, make sure their feet are flat on the floor. Keep your hand on the patient's back for a few seconds after the pivot for stability and ask the patient about dizziness. Once the patient has stabilized, put the patient's shoes and socks on and make sure once again that the feet are flat on the floor. If not, have the patient scoot their hips forward so their feet are positioned correctly. The gait belt is strictly an assistive aid, not a restraint. They should never be used to tie a patient down. When used properly, they provide stability at the patient's center of gravity, which reduces injury to the patient and reduces falls. Gait belts are secured around the patient's waist snugly. You should be able to fit 4 fingers between the gait belt and the patient's abdomen. This makes the belt snug enough to be effective, but loose enough to be comfortable. Once the patient's shoes are on and the gait belt is positioned around the waist properly, position the wheelchair right next to the bed at a slight angle and lock the wheels. You will stand in front of the patient with one foot across the front of their feet and one foot parallel to their closest foot. Bend your knees, grasp the back of the gait belt, and have your patient place her hands on your shoulders. Lift up and swing around to place the patient in the wheelchair. The patient cannot take steps. You are relying on momentum to move the patient, so this should be a smooth, continuous movement, up, over, and down. Unlock the wheels and move the wheelchair away from the bed to put the foot pedals in place. Relock the wheelchair. Leaving a wheelchair unlocked is a safety hazard. If the floor is uneven, the wheelchair can roll away. If the patient tries to get up, the wheelchair will roll out from under them, causing them to fall. Patients can be shown how to unlock the wheelchair if they wish to move around on their own. Never leave a patient sitting in an unlocked wheelchair. Move the foot pedals to the forward position. Place the patient's feet on the foot pedals. Ask the patient to scoot their hips back in the wheelchair if possible to make sure they are seated properly. Remove the gait belt. Gait belt should not be left on the patient. Ensure the wheelchair is locked and the patient can reach the call light. You will be leaving the patient at the side of the bed at the end of the skill. Perform your closing. Watch the instructional video for step-by-step instructions on how this skill is performed. When you've watched the videos, try this skill on your own.